Want to hear a crazy fact that most parents never hear? Within the first year of life, your baby's brain will double in size and form over 1 million neural connections every second, making this the most critical period for neurological development they'll ever experience. Yet, conventional pediatric care focuses only on whether babies hit basic milestones within these broad time frames, completely missing whether their nervous system is actually functioning optimally. Milestones are important, but let's start looking at them from a different perspective. This video is for parents of babies in their first year of life who sense something isn't quite right with feeding, sleeping, or development, and those who want to ensure they're giving their child the strongest possible neurological foundation from the very beginning. We're going to reveal why hitting milestones on time isn't enough and how the perfect storm of early stressors can create lasting neurological patterns that conventional medicine completely overlooks. You'll discover the hidden significance of your baby's early milestones and how to recognize when your baby's nervous system needs support during this critical window. It's truly a gift to be able to walk alongside parents from the beginning with their little one and watch how they can go from colicky, uncomfortable, stiff, arching, refluxy, difficulty sleeping, pooping, latching, whatever it is, and they become a different baby. Those are the words we hear in our office so often. We have a different baby than a month ago. They're sleeping better. They're pooping. They feel comfortable and happy. And what I love to see is that the whole family is happier too, because now they can sleep as well. They can enjoy these early months with their baby because their baby is happier and healthier because their nervous system, that foundation that controls every system of their body, got some help. So to jump into this video, we're going to get a little nerdy. So buckle up and here we go. According to the Harvard Center on the Developing Child, the first year of life represents when neuroplasticity is at its peak, one of the most rapid periods of brain development in the human lifespan. During this time, your baby's brain undergoes extraordinary neuroplasticity with peak synapse formation, creating the fundamental architecture. It builds their brain that will influence every aspect of their health for the rest of their life. Yet here's what's happening in the pediatric offices across the country. Parents express concerns about feeding difficulties, sleep issues, excessive crying, or developmental quirks, only to be told these are normal variations or advised to wait and see if their child outgrows them. And this approach completely misses the critical window when neuroplasticity is at its peak and gentle interventions can have the most impact. A baby can technically pass their developmental screening while still compensating for underlying neurological dysfunction through tension patterns, asymmetrical movement, or skipped developmental stages that will impact them for years to come. Your baby's ability to breastfeed effectively is actually their first major neurological test, requiring coordination of multiple cranial nerves to open the mouth, to press the tongue, to bring the nipple in, to close the tongue around in a U shape, to suck, to swallow, to create this wave like motion. It's a lot of coordination of these nerves, of these neuromuscular um, structures, and precise timing between the nervous system and this neuromuscular coordination is required. So when we see feeding difficulties like a shallow latch, like frequent popping off, gasping during feeds, or a baby who becomes excessively exhausted while eating, these are often early signs that the nervous system needs support. Then there's head control. Head control development between 8 to 12 weeks indicates proper cervical spine and deep neck muscle development. It creates stability. While challenges like persistent head turning to one side or difficulty with tummy time, those can signal early neurological dysfunction. The most neurologically significant milestone is crawling between 7 to 10 months, which establishes cross pattern movement that stimulates balanced development of the corpus callosum. It's an area in the brain that connects both hemispheres, which then builds the foundation for later skills like walking and reading. So, what disrupts this optimal development? We like to call it the perfect storm. It's multiple stressors that can accumulate and overwhelm a baby's developing nervous system, creating patterns of dysfunction that persist long after the initial stressors have passed. It's because it's the foundation. The nervous system is the foundation. Think of it as a house. If the house's foundation is strong, as we continue to build the house, as we start to access the higher centers of the brain and different skills, those will happen at a higher and more optimal level because the foundation is solid. But when we have prenatal stressors, including chronic stress during pregnancy that affects fetal brain development, while birth interventions like Pitocin induction, forceps, vacuum delivery, and C sections, all of this stress and positioning issues, they can place significant pressure on baby's head and neck. And yes, sometimes these things are necessary and life saving. And we have to deal with the reality of the aftermath. If there's neurological dysfunction resulting from these interventions, first we got to find it and then we got to focus on it. We got to focus on helping a child as opposed to just waiting and seeing how it goes, as opposed to just letting this crucial window of development just let us slide by. And that doesn't finish the story. Then there's environmental stressors, stress on stress on stress after birth, like disrupted sleep patterns. We got overstimulation, early antibiotic exposure, and feeding challenges. This continues to stress out an already vulnerable nervous system, pushing babies into something called sympathetic dominance, where they get stuck in fight or flight mode. And this is unfortunately how conventional medicine can miss the neurological foundation. Your pediatrician might check off that your baby can roll over at 6 months, but they're not assessing whether that rolling movement is symmetrical, is it coordinated, or built on proper foundational development. Conventional pediatric care consistently overlooks the assessment of subluxation and dysautonomia, the neurological interference and imbalance that can develop from the perfect storm of stressors. These functional problems rarely show up on standard tests, but can profoundly impact how well your baby eats, sleeps, develops, and regulates their emotions and behavior. And that's where we come in to help your baby thrive and to get the stuck neurological stress, subluxation, tension, and fight or flight mode stuck on off the system. We used advanced scanning technology. It's called insight scanning technology to objectively assess your baby's nervous system function through gentle, non invasive scans. It measures heart rate variability, muscle tension patterns, temperature regulation, gives us an idea, a clear picture of where stress and dysfunction exists in your baby's nervous system, showing balance, symmetrical patterns in healthy infants or areas that are indicating stress that may need support. So rather than waiting for problems to develop, we take a preventative approach, supporting optimal nervous system function from the very beginning when neuroplasticity is at its peak. If you sense something in your mom or dad gut that isn't quite right with feeding, sleeping, or development, and you want to ensure as a parent that your child has the strongest possible neurological foundation from the very beginning, click the link in our bio to learn more about neurological development. Thanks for watching. Have a blessed and wonderful day.